Good afternoon, good evening, good morning. My name is Tyler Holmes. I'm a program lawyer with Irish Rule of Law International in Lilongwe, Malawi. And my work focuses on pretrial detention and child justice issues with the Malawi Police Service. I'm joined by three panelists for today's conversation about policing reform on the African continent. The panelists are Louise Edwards, the Programs and Research Director at the African Policing Civilian Oversight Forum. Louise has spent the last 10 years working on police accountability across Africa. Her focus has included the provision of technical legal assistance to organs of the African Union, regional economic communities, and national stakeholders in the drafting and implementation of regional legal standards for rights-based policing. This includes leading the drafting of the guidelines on the conditions of arrest, police custody, and pretrial detention in Africa, the guidelines on the policing of assemblies in Africa, and the common standards for policing in East Africa. Before this, Louise was a lawyer in private practice and in the community legal sector. Olusegun Kehinde is the co-executive director and advocacy manager at Youthrise Nigeria. His work is focused on drug policy, harm reduction, human rights, women who use drugs, and access to HIV and sexual reproductive health interventions. And then Matthew Mutiso is the executive director of Action for Preventative Mental Health in Kenya. Matthew advocates for solutions to cross-cutting issues affecting mental health stakeholders like investment, capacity, and linkages with partners and collaborations. He also runs the Nanga Support Network, which initiates psychosocial support programs for current inmates and correctional officers and supports reintegration of people who have completed their sentences with transport and reentry support to help reduce stigma and recidivism. To give a brief overview of the session, our conversation is going to start with highlighting the status quo of police and prison detention across a few jurisdictions on the continent, in particular the ones where our panelists are. So Louise in South Africa, though I know she has also a number of regional potentially a number of regional examples to share. Olusegun in Nigeria and Matthew in Kenya. The panelists will then talk about interventions they're part of and some of the challenges faced. And finally, I'll ask each of them kind of where the conversation goes from here. And as Ronnie said, if you have questions throughout the session, send them in, let us know. I'll try to incorporate them or we'll add them in at the end. So for starters, the conditions. For more information about the status of police detention in various parts of the continent, I highly recommend Nigerian journalist Fisayo Soyombo's 2019 investigative series, where he got himself arrested for a made-up charge and then spent 5 days in a police cell and 8 in Ikoyi prison. And I think, at least based on my experiences in Malawi, many of the conditions overlap. So part of my job does involve going into police detention multiple times a week, and police cells are cramped. They're concrete. Very often they don't have any kind of blankets or covering on the floor. So they're often cold. They're dark, often sometimes painted black. They have small windows, and so are poorly ventilated and have poor facilities for going to the bathroom and washing. So we'll start with Olusegun. Youthrise has engaged in surveys about prison conditions around Nigeria. What would you add to the brief description I just gave, and kind of what briefly, what else have you seen in your time in police and prison detention in Nigeria?
Okay, all right. Thank you so much, Tyler. Good morning, good afternoon, and good evening, everybody, depending on on your location. Yeah, it's exciting being on this panel today. And in 2017, we actually conducted a study across 7 prisons in 4 states in Nigeria, primarily to get data of young people in prisons, for drug-related offenses, and the experience is not far from what you have described, Tyler, given how overcrowded, many of the prisons are actually, in fact, from the study, we're able to actually deduce the fact that that many of the prisons in Nigeria are actually about 50%, above capacity, and also to the condition as well, of the prisons, even when it comes to even service provision, that's healthcare in those prisons, many of them are actually lacking, or should I say insufficient. And, a lot of the prisons, in Nigeria, we call them correctional facilities now, because the law has been amended, and unfortunately, a lot of these facilities have to depend on NGOs, faith-based organizations to actually provide support such as food and basic relief materials, and also of course the conditions as well are not friendly. So yes, it's not in any way different from what you have said. Although there's some prisons that actually, in Nigeria, there's some prisons where say former politicians or should I say corrupt politicians are sent to. Some of these prisons have better amenities, given the profile of the kind of inmates. Yes, because I know one of the prisons. I saw the inmates, playing basketball. Yes, it was quite basically. There was that. That difference. Night and day difference. Between prisons. Where you send. Just like members of the general public. It's different from the one where. Where high profile, inmates are remanded. So yes, so that's something really profound that we got from, from that study.
Thanks. And I will note that, prisons in Malawi, often have a football pitch, but I don't think they really have goals, right? They don't have, they don't have netting. So if you're talking about, I'm curious, when you're talking about the hoops, like seeing a basketball court, does the hoop have a net or chains?
Well, no, but it was really organized. Like it was cleaner, it was neater than some of the prisons, that we had visited. Actually, yes, it was more organized. It was, the environment was more, at least habitable, compared to the other one. But but one thing that really came out was actually the overcrowded conditions in the prisons, and from that study we're able to actually deduce that about 59% of inmates were actually on pretrial detention. Lots of them were actually awaiting trial. And of course, that's one thing that really contributes to the overcrowded conditions of the prisons.
Thanks. And for those who aren't having these nicer conditions, Matthew, we had a conversation a little bit about what the standard conditions are in preparing for this session, and you used the word or you used the phrase "pains of prison." That the impact of detention on someone's physical and mental health causes pains of prison. What all do you include in that phrase?
Thank you, Taylor, and greetings everyone who's joined us this evening in Nairobi. Well, thanks. Pains of prison. Basically, when you talk about pains of prison, this is the prolonged adaptations to the various frustrations and life in prison that carries a psychological toll to a person. These could be physical stressors, for example, like what previous panelist has mentioned, like overcrowding, poor sanitation, beddings, vector infestations, low nutrition, such kind of things. And also maybe you can add on top of that violence. There's an element of segregation, there's an element of bullying, or maybe sometimes you happen that some of the inmates who find themselves there, perhaps they do have some mental or emotional conditions. Some people we normally would call them easily like maybe an introvert, somebody who's perhaps have some antisocial personality. These are people who will be at some point finding themselves widely and arbitrarily being removed or segregated, mostly from the prison support system, yeah, because there's a way that prison works, and you find some of these guys sometimes end up in solitary confinement, disciplinary measures, and all that kind of things. So all these stressors, and also the idea that you've been removed from your normal environments, all these stressors, as they come together and compound, this is what we call the pains of imprisonment, yeah. And they're basically, these are stressors that land on the mind of a person. That's what we call pains of prisons. Yeah, thank you.
Okay, great. And I think, you know, again, we talk about these things to kind of lay the groundwork for you know, the subject of the panel, which is reforms. So, you know, what we've just talked about are actually realities of police and prison detention on the continent before COVID-19, before the global pandemic of the last year plus now. And I think it's important to note that incarceration as a criminal justice model was largely adopted as a result of colonialism. Nigerian professor Atanibi Alemika has written often about this subject, and Kenyan journalist Patrick Gitara wrote about the same last October for The Republic. And Gitara noted in his piece, you know, there does not seem to have been much resistance to the idea of incarcerating people, even when those people were convicted for activities that they would not themselves consider offenses. And this is where I kind of want to bring you in, Luis. You know, this, you know, I note that in part to transition to petty offenses, and in part to note that, you know, as much as we might want to connect to a pre-colonial sense of things, there has been kind of widespread adoption by African publics of the colonial models of policing and incarceration. And so, you know, I think that's important to note, but, you know, specifically on petty offenses, you know, and this last year with COVID, you know, what does this create for those who get involved in the system? You know, this combination of criminalization of a wide range of behaviors and a carceral model of punishment.
Yeah, thanks, Tyler. It's, I mean, it's a complex question, and one yeah, that requires more than the minutes that we've got to talk about it. But as you've pointed out, this issue of petty offences is one that is very much sitting at this intersection of debates about how we decolonise criminal law and notions of incarceration on the continent. So that's the things that Alemika and Gitara have been writing about. That broader issue of decarceration and public health responses to what are currently criminal justice issues. And unfortunately, the COVID-19 pandemic has only served to highlight and to sort of exacerbate a lot of the issues that we've already observed in terms of petty offences. And as you sort of described in that intro there, it really is about arresting, detaining, enforcing the law against people who have been othered in terms of those who hold power. And so we saw it during the colonial era, and we're seeing it now in the post-colonial time, that these same laws that were so effectively used to segregate, to punish, and to keep down people are still being used in our modern democracies. So at the regional African level, there's very much been a focus on petty offences as a way to address, or decriminalising petty offences as a way to address some of the colonial overhang and the issue of over-incarceration, overuse of pretrial detention and overuse of police detention, and to try and put in its place a development approach, community safety approaches, and public health approaches. And it was a movement that actually started where you are now, back in 2015. A street vendor named Maeso Gwanda was on his way to work. He sold plastic bags in Limbe, and he was arrested for being a rogue and vagabond, which is one of these provisions we find in colonial era laws that remain in place across the continent. They're vague. They control and segregate public spaces by providing a wide discretion to law enforcement officials to implement them. And they're very broad in their construction. So it's very difficult to say what is a rogue and what is a vagabond? What is the behavior that's going to lead to me being arrested and charged and detained for being a rogue and vagabond? It's the same. We see idle and disorderly is in use in South Africa, and I think in Kenya as well. And Nigeria, I know, has got its own slew of laws. And they're completely ludicrous in their construction because they criminalize or are used to criminalize life-sustaining activities in public spaces. And if we think about our context, we are still in a development context where the majority of our populations are living in states of poverty in many countries. Yet we've got a criminal justice system, when you look at rates of overcrowding, up to 60–70% of people in detention are in for petty offences. We're criminalising the poor. We're making them criminally responsible for existing and etching out a living in a public space. So they're very low-level crimes, but they've got an enormous impact on the people against whom they're enforced. And Mr. Gwanda successfully challenged the rogue and vagabond provision in the Malawi High Court, which changed the law for Malawi and has had a bit of a ripple effect across the rest of Africa. So we've now got the African Union level mechanisms making pronouncement on these things and calling on states through the adoption of the principles on the decriminalisation of petty offences, and also the recent judgment by the African Court on Human and People's Rights, or their recent advisory opinion, to remove these vagrancy-related offences from the statutes, remove the perverse incentive to target, to arrest, to harass people who are poor or otherwise marginalised. And we know it affects sex workers, people who use drugs, the LGBTI community, and street vendors, and to put in place a development, community safety, and response that takes into account issues of public health. And COVID-19 only exacerbated it. My last point is that we had official policy in many countries saying decarcerate, decarcerate, get people out of pre-trial detention, get people out of prison, and stop detaining people in police custody as a public health measure. But on the other hand, creating these offences under emergency legislation, which are petty offences, for failure to wear a mask, being out after curfew, limitations on vending, not loitering in parks, which were then enforced. And in South Africa, we had, I think, 60,000 arrests for violations up to August 2020. So COVID-19 just made sort of clear what we had been complaining about for a long time, which is this is not a community safety and a public health response. And we need to decriminalize our criminal law and think about a better way to do this.
I couldn't agree more. And the Meso Gwanda case is one that we have used in our programming. Unfortunately, I have still seen police in Malawi arrest for rogue and vagabond because there are two other sub provisions that were left in the law. And you mentioned idle and disorderly. Here in the Lilongwe, the police arrested, what was the right number? They arrested about 75 people last weekend for idle and disorderly. So those things are alive and well. And I do want to come back to that the next time I ask you a question. But just in the keeping of having a little nuance, I do want to note again, as we did to some extent on conditions, that there is nuance. These systems are not, one size fits all, and they do not always screw up. As Louise just mentioned, a lot of the official policy was to decarcerate, was to make massive releases to prison systems around the continent. And Malawi was one of those examples, with a couple thousand people fewer now in the prisons, which are still over 200% capacity, but a couple thousand fewer people in prison in March 2021 as compared to March 2020. And in my observation, I've spent about 3 years in this country. the police cell congestion was at its lowest for the period of April to July of last year. Now, Malawi's done some catching up. Second wave of the pandemic have arrested a few thousand people in January and February to enforce COVID regulations that were on the books since August. So, go figure. But I did want to offer, some praise, because there is some praise to offer. And I do, with that, I want to go back to Matthew, because Matthew, in our conversation, you noted that you've spent some time in police and prison condition cells in this last year, and you have seen some positive things too, in terms of mask wearing and attention to the pandemic.
Yeah, thanks. But I really like what Luis has actually, the way she has spoken about petty offenses. And the same thing applies here in totality in Kenya. And one thing I must say, there was a certain kind of relief from out of COVID. I mean, it in a way, it brought a balance to the justice system, in that there was a massive reduction in arrest, especially there was even a declaration, I think, from the government interior ministry, that petty offenses would not be taken to court. And at some point, what she has very well stated as crimes for income crimes, generating income crimes, jaywalking, pushing a handcart, or maybe jaywalking, being arrested also for either smoking weed, perceived as a drug user. All these petty offenses, at some point, they were put on shelves, and guys were not being arrested for the entire almost period of COVID, up to late last year. And in the courts themselves, normally pre-COVID, you'd find a person arrested for such an offense and being fined for, let's say, $2, or being imprisoned for 1 month. Which ideally, at some point, you'd ask yourself, what is the rationale? Why is the judge doing that? Even the magistrate. But now we saw those kind of arrests go down. Actually, they became almost non-existent, apart from the ones that were created out of COVID, like she has also talked about, not wearing masks, violating curfew rules and all that, which now became opportunistic for the law enforcers and the police. But I happened to visit some of the prisons and also the police stations. And the feedback I even got from some guys whom I found there is that the conditions even in the police station had improved, because at that point they were not being taken to the remand facilities. They had been kept at the police posts. Their diet actually changed. They were given better food there, and some of them actually felt like they were less overcrowded, because most of the time police would handle issues at the front desk, or maybe outside, and then release people either from bribes or whatever reasons. But the guys who were in the cell, some of them actually stayed there for quite some time. I remember, I think I saw a guy who had stayed there for almost 3 to 6 months, and he was happy. He compared to previous arrests that he had had, the conditions there are much better. The same thing also happening in some of the prisons. The prison staff also took a further step, especially when it came to the congestions. There was a lot of distribution of inmates from one center to another, so that they can at least have a breathing space or something, at least a good environment. There was the courts also, by nature of them being closed at some point, and also handling more heavy and weighty offenses also added to that fact. And positively, yes, there was intention from the government itself to see that the life of inmates were better, were improved, the conditions were okay, and going towards now coming to this year again. Now, perhaps we hope we don't need to go back to some of those issues that Luis has talked about, especially when it comes to petty offenses. The idea of just arresting people for no apparent reason or criminalizing poverty for that matter. So we are hoping that we can come up with laws that can actually fit in at this time to protect the little gains that COVID perhaps has presented. Yeah, thank you so much.
And we'll get to hopefully that aspect in a few minutes. So to go back to kind of what we've established at this point is that common traits between many criminal justice systems on the continent are a proclivity to criminalize behaviors of the poor and use incarceration over short or long periods of time to penalize that behavior. So I know you've been out of the conversation a little bit. Shay, I think what Youthrise Nigeria's work shows is how poorly these commonalities, that system addresses underlying causes of crime. So, what is Youthrise doing on drug-related offenses to try and change some of that or address some of that reality?
Okay, thank you. Well, before I respond to your question, let me make a comment to something Louise and Matthew had spoken about, because the truth is, even in Nigeria, law enforcement, it still has the coloration, or should I say the fingerprint of, colonialism. Going back to the study we did in 2017, I had the opportunity to actually look at the arrest warrants, of some of the inmates, and a bulk of them actually had wandering, so a bulk of them were actually arrested and incarcerated for wandering, and and of course, if you look at the history, of law enforcement in Nigeria, you realize that, an offense such as wandering, was there during, was put in place, by the colonialists, to actually define where, Nigerians could move to or blacks could go, and where they could not go, and and it's unfortunate that, that we still retain, many of these, things to date. Now, as Youthrise, as an organization, primarily we're actually an advocacy and service delivery organization. Yes, I'm primarily advocate for evidence-based, drug policy, reform in Nigeria and also in the West African sub-region, right? And during the outbreak of the COVID-19 pandemic, of course, just as we saw in many other countries, the government of Nigeria decided to decongest the prisons. But unfortunately, young people and people in prison for drug offenses were not even part of the amnesty criteria. And and like I kept on saying then, I kept on saying it would be insane for you to have someone, in prison at that time for just a rack of cannabis, because of course, looking at how punitive the Nigerian drug policy is, it prescribes 15 to 25 years imprisonment for drug offenses, right? So whether you're caught with a rack of cannabis, or you're caught with maybe, with less than a gram, of whatever substance it is, you're liable to 15 to 25 years imprisonment, right? And from our research and our study, we realized that, our prison system are not reformatory, they're actually deformatory, because at the end of the day, you have people that have gone in as just users and then they come out worse, they come out as dealers, yes, we found that also looking at, at how the criminal justice system does not address the social determinants, crime itself, issues around poverty, right? And even when you look at drug use, right, you need to understand why people use drugs in the first place. And we could see that during the COVID-19, during the lockdown, we had like, increase in drug use, because people were actually, indoors, means of livelihood, basically they needed drugs as an escape. Now imagine you now arrest people like that, and then at the end of the day, you still put them in prison. And I know Louise, spoke about the call for alternatives to incarceration, that is decriminalization, because of course, that is what we're also advocating for down here in Nigeria, and even in the global drug policy space, for countries to begin to see drug use as a public health, as a human right, and also development agenda. You know, a holistic, to drug use, right? And also address the social determinants, to drug use itself, usually around poverty, and also ensure that, right, even in carrying out, drug control, we still respect and uphold human rights standards, because of course, in Nigeria, I'm sure many of you are aware of the protest last year, NSAS protest, where young people actually took the front, about police brutality. And yeah, unfortunately, that protest, also ended in more brutality. We could see how, the day, and I mean, I'm really crazy because in Nigeria, there's a mantra, the police will always say, yes, the police is your friend. But in Nigeria, I doubt any Nigerian will actually agree to that. We actually agree to that. If I personally, I've also experienced, police brutality itself. I mean, I was driving with, with my friends coming from, from a friend's wedding ceremony, and we were stopped, and we had to come out of the car. Yes, they beat us, and and we're like, for nothing, for doing nothing. For doing nothing. So the truth is, if you look at the relationship of the citizens and the police in Nigeria, it is characterized by, brutality, extortion, arbitrary arrest, and of course, if you look at the war on drugs, right, which is even imported, at the war on drugs, looking at our drug control law in Nigeria, right, realize that because this is